I am truly honored to be here today on this stage, and I'm beyond excited to talk to you guys about healthcare, healing, and connection by bringing your authenticity to the table. But first, we must ask ourselves a fundamental question. What makes us human in the context of healing? For those of us in healthcare, doctors, nurses, therapists, technicians, caregivers, we are entrusted with something so sacred, the health and well-being of other human beings. But beyond the knowledge, beyond the technical skills, beyond all of those things lies something that can heal more powerfully than a surgical procedure or a prescription. And that something is authenticity. Today, I want to talk to you about how bringing authenticity in medicine can be a true game changer, can transform the way that we interact with our colleagues and with our patients. But first, I want to share a little bit of my journey to set the stage. I was born and raised in a small town in North Georgia, Gainesville. My mom was 19 and 20, my dad was 20, and they had no college degree, no job, but they had a new marriage and a new baby, and they needed money. My mom was the daughter of a mechanic, my dad the son of a pilot, so they were mechanically inclined. So they went around to yard sales, bought things, and repaired them, and sold them. And that's how they started making money. The more things that they sold, they realized that the things that sold the most were bicycles. So they began to buy more and more bikes. And they would open what would become the largest bicycle shop in North Georgia, and still is to this date. So about a year into their marriage, they realized that they weren't made for each other, and they divorced. So my mom raised me. She was first a seamstress and then went into law enforcement. And like any little girl, I adored my mom. I thought she was so cool. So I watched her every day get ready for work. She would put on her police uniform, her bulletproof vest, all the gear, listen to the police calls, and I thought, wow, my mom's a badass. I want to be just like her. So, eventually, she remarried. I had a brother and a stepdad, and I became an avid softball player. I loved softball. My mom told me that I was so good that I could be a professional baseball player. So if I didn't become a police officer, I was going to be the first woman in the major leagues. And my mom told me that I could absolutely do that because a woman could do anything that a man could do. So fast forward to about a week before I started high school. It was softball tryouts for varsity. Even though I was just merely a freshman, I had my eyes on varsity. So my mom was on night shift that night. She told me when she got home from work that she would take me to tryouts the next morning. I could not even sleep. I was so excited. So I remember waking up the next morning, and it was weird because both of my aunts were standing over me. And they said, "Betsy, we've got to get to the hospital. Your mom's been in an accident." I said, "What?" She's supposed to take me to tryouts. I was mad. I'm going to miss tryouts. So we went to the hospital, and I remember her neurosurgeon. He stepped off the elevator, and he said that she had been in an accident and had broken her neck, and she was never going to walk again. So I thought, okay, well, he had to be lying. I mean, my mom was strong. There's no way that this could happen to us. So we went through all the surgery, the rehab. I did everything with her. We went to months of rehab, learning how to take care of her, how to feed her, how to bathe her, how to get her from the wheelchair to the shower to bed, and repeat that every single day. She went through rehab at the Shepherd Spinal Institute in Atlanta, and I saw so many people that were just like her, families just like us. And I thought, well, when I grow up, I don't know if I want to be a police officer. That's kind of dangerous, actually. So maybe I want to cure spinal cord injury. Maybe I'll become a doctor. That's it. I'm going to become a doctor, a neurosurgeon, and I'm going to cure spinal cord injury. I'm going to help people just like her. So I went to college. I took an academic scholarship at the University of Georgia. I actually was offered a softball scholarship here at Emory. Sorry, declined that. So I went to the University of Georgia in medical school, and then I matched into neurosurgery. And all along the way, I heard, I'd tell people what I wanted to do when I grow up, and I'd say, I'm going to be a neurosurgeon. And they would say, you're going to be what? You're a woman. How are you going to have a family as a neurosurgeon? And I thought, a family? Nothing's going to get in the way of my dreams. My mom told me that I could do anything that a man could do. So throughout residency, like many of us, I struggled with finding my voice. The pressure to perform, to meet expectations, the stress of fitting the mold of what a neurosurgeon was. Perfect, stoic, distant. Yet, after all, that is what a typical healthcare professional is, right? So I went through and I had an experience one day with a patient. It was a young woman. She had seen many people before me, and she came in to see me, and she was in pain, and no one could tell her why. So I talked to her, listened to her. I went through all of her records, all of her imaging, and then I gave her my suggestions. And at the end of that conversation, she looked at me and said, "You're the first doctor that's not made me feel like I was crazy. You actually listened to me, and you made me understand what's going on with me. And I was almost suicidal in pain, but now I feel like I have answers in which I can change my life." And in that moment of connection with her, I realized that it was not about all the knowledge that I remembered or the books that I read or the surgical techniques I learned. It was about me being with her in that moment and not being as some distant healthcare professional. And that moment changed me. Authenticity isn't just a nice to have quality in medicine. It's essential. You have to realize in the high pressure, fast paced world of medicine, that often is left to the back burner. We don't have time for that, right? But yet our true connection happens whenever we stay true to those initial goals. So what does it mean to be authentic in medicine? And how do we reclaim that authenticity without compromising our professionalism? Well, first, it's about aligning your values with your practice. So when I talk to doctors and healthcare professionals, I ask them, why did you go into medicine? Many of them will say it's because I wanted to help people, right? But in today's healthcare world, it's different. We have the pressures to meet the metrics, the healthcare insurance, the billing. We push all of that to the back burner so we can just get our job done. And yet, our best work comes when we stay true to those initial goals. Second, it's about enhancing our communication. When we're talking to patients, are we reading a script or are we truly speaking from our hearts? Are we thinking about the next task on our list, the next procedure, the next thing we have to do? Or are we there in the moment with our patient? You see, the best authentic communication happens when you are truly present, when you make eye contact and you're listening, not only with your mind, but with your heart, to ensure that patients are seen, heard, and valued. And that's so important, right? In fact, the data supports this. A 2020 article in Studies in Health Technologies and Informatics said that patients who feel understood and connected to their healthcare professionals are more likely to follow treatment plans, have higher satisfaction, and improved recovery. And another study, 2020 study in healthcare, demonstrated that increased empathy amongst healthcare professionals, that patients responded to their therapy better, and they actually had increased overall well-being. Next, authenticity matters with our team, with our colleagues. So when we think about healthcare, it's a team effort. It's not just about one person. So when we are talking with our colleagues, are we vulnerable, open, and honest with them? Do we tell them when we're overwhelmed or when we don't know the answers? Do we feel safe to do that amongst our healthcare team? And that environment that fosters that true, authentic communication is so important. Every member of the team is vital. And when we think about the vital members of the team, who is it really, right? So if you see this picture, this is a picture of me and my PA performing a complex 9-hour operation on a patient. You're thinking, well, those are the two most important people in the room, right? These are the people that are making it happen. Well, guess what? There are 20 or more unpictured people in this room that are helping us. They are all vital members of the team helping me perform this operation. And if any one of them falter, our surgery won't be a success. So you have to realize that you, as a team, you are only as strong as your weakest link. But yet in training, that just kind of is not true. We're thrown in this environment of competition, of survival mode, really, where we're struggling, where we feel like we have to be better than the next person to be successful, right? So we're climbing over each other to get to the top. But why is that? Why aren't we helping each other get there together? That's kind of counterintuitive. I mean, healthcare is about helping people. So why aren't we helping each other? So what I've learned over my years in practice is that a supportive, collaborative environment that fosters this goal of teamwork is critical. For us to be authentic and support each other in the workplace is vital. And you know what I've seen in my practice? Not only has that led me to have higher volume in my practice, more and more patients, it's allowed me to provide better care for those patients and have better outcomes. And that's a win-win situation for me, but for my team, and most importantly, for my patients. And lastly, authenticity in medicine has to do with self-care. We often don't think about ourselves. Healthcare is a selfless effort, right? But we can only show up for each other and for our patients if we show up for ourselves. And you may not know about this about me, but I've been on my own self-care journey. So I treated initially in high school after my mom's accident, my stresses and anxiety with binge eating. And I became more and more unhealthy. In fact, I was in my unhealthiest state when I was postpartum with my son about 8 years ago. And I leaned into the bassinet to grab something out, and I felt a knife in my lower back. It took me to my knees. I was laying in my bedroom. I vividly know this moment. And I yelled for my husband to help me, and he picked me up, put me in a chair. And it was the most intense pain that I've felt in my entire life besides giving birth to my son. But I was like, okay, I know what happened. I herniated a disc in my back. I just became the patient that I take care of every single day. And for what? I realized in that moment that I had to change. I had to be better for myself so I could continue to do this and be better for my patients. So I began to learn about fitness and nutrition. And you might say, well, you're a doctor, shouldn't you already know that? Well, let me tell you, they don't tell us all these things in medical school. So I learned about nutrition and diet and how I can make sustainable changes for myself. And I went on to lose 80 pounds over the past 8 years, and I have kept it off by all of these things that I've learned. And I want to just tell you that self-care is truly important for us and our abilities to show up for others. And lastly, a part of my journey has actually been sharing my journey. So we are all the things that we've been talking about for the past 15 minutes about teamwork, collaboration, empathy, communication, all of these things. We're all students. We all learn from each other's experiences. So if we learn from each other, then we have to share our experiences, right? So in 2020, I don't know what I was thinking, but I made a silly TikTok video, right, about being a woman in neurosurgery. And in that moment of authenticity, it changed my life. This video went viral, and I launched a platform that I never in my wildest dreams would have ever imagined that I would have today. I share my life every single day, from medicine to motherhood to everything in between, with over 5 million people across the world. And what I'm able to do is to humanize medicine, to explain to people on an understandable level what's going on with their bodies and how they can make sustainable changes in their life to be better for themselves. And that is truly profound. So I want to just end by saying healthcare is something that is extremely stressful, but we have to have balance between our knowledge of science and the art of connection. So what is the most valuable tool that we have? Is it the scalpel or the stethoscope? It's actually about the trust that we develop with our patients, the empathy that we share, but most importantly, about the authenticity that we bring. And I ask you to reflect on these to conclude. What would it look like instead of trying to live up to some external idea of what a perfect doctor or nurse is that you simply showed up as yourself? And secondly, what if you leaned into your passion, your purpose, and you let that guide the way that you care for others? I truly believe that it would change everything. I thank you so much for allowing me to be on the stage to share my journey, but most importantly, I encourage you to embrace your own. And I specifically want to thank my family, my husband, my kids that are here today, my mom, my stepdad, my brother, my aunts that were there that day, because without them, I wouldn't be here with you on the stage, because you all only are as true, as strong as your weakest link. So thank you guys.